Hi, welcome to Health Stack. Health Stack is an electronic medical record that is used to manage your health facility. In this video, we'll be walking through the ward. In the ward, you'd be able to check out your admission lists, your inpatient lists, your discharge lists, and your dashboard. Here you can see the amount of available bed spaces you have in your facility. You can see the amount of patients you have occupying the bed spaces. You can see your pending admissions, and you can see the number of admitted patients. You can check for today, this week, this month, this quarter, and this year. You can see the number of discharged patients for this week, this month, this quarter, and this year. So here you can see the amount of admitted patients and discharged patients in a graph. You can see the distribution of patients you've had according to gender, and you can see your readmission rate. You can see the average length of stay of your patients. So from this dashboard, you can have an idea of what's going on in your wards. So admission lists. This is the list of patients waiting to be admitted. These are patients either sent from the front desk, patients who went to the front desk and then they were immediately asked to be admitted, or patients who from clinic were the next step of actions they asked to be admitted. So I'll be walking through this patient, Kasim Mayowa. So his status is pending, and I would like to admit this patient. So you can see the instructions are to give fluids and monitor vitals. And the ward that I was asked to admit this patient is ABC ward. So this tab over here means how the patient will be billed. Family cover means that the patient is on a family plan. Cash means the patient is paying for cash. And billing mode means the mode that the patient will be billed. So here I can choose the bed. Each ward has different number of beds. So if the beds in your ward are, let's say, labeled A to Z or 1 to 10, you would indicate this when setting up your ward. So mine in my ABC ward is 1 to 3. So I will say bed 2, and I would admit this patient. So you can see Kasim is no longer here. And I would go to my inpatient. So you can see he's here. So to manage him, I'll click on his name, and then this dashboard will pop up so I can manage this patient here. After I have finished managing the patient and I would like to send this patient for discharge, I would go to actions, end encounter, and discharge. So you can see this pop up. So follow up in 2 days. So I'll click this button here, discharge the patient. So if I go back to my ward and my inpatient list, you can see there. So go to um, discharge list. You can see it's here. So it's pending. That means I have not completely discharged the patient. At this stage, if the patient has not completed paying for their the services that have been offered to them, this is the stage where you try to get that settled before you complete the discharge. So when the patient is done with everything, you then completely discharge the patient. So you can see there is no discharge list again. Let's go back to the inpatient list. You can see the patient is no longer here. So that is how you admit a patient, um, check in the patient, and discharge the patient. Thank you.